Good morning. My name is Mayuri Harihar from final year of B Physiotherapy and my topic is diagnosis of encephalitis and management. So, what is encephalitis? Encephalitis is an inflammation of the brain, typically caused by the viral infection, but it may also result from bacterial fungal infection or autoimmune causes. It is a neurological emergency that requires prompt diagnosis and treatment. Now, diagnosis of encephalitis. Clinical evolution. First is history. History of fever, headache, altered mental status, seizures, confusions, photophobia, vomiting, focal neurological deficits. Now, physical examination in which neck stiffness, impaired consciousness, abnormal reflexes, cranial nerve abnormalities. Second is laboratory investigation. Blood test, lumbar puncture, then high white blood cells count, elevated protein, normal or slightly reduced glucose, PCR testing for HSV or enterovirus, etc. Neuroimaging. MRI of brain preferred over the CT scan shows the areas of inflammation, especially in the temporal lobe in HSV and encephalitis. CT scan of the brain done initially to rule out the space occupying lesion or rise intracranial pressure before LP. Now, electroencephalogram detects the abnormal brain activity, may show diffuse or slowing or epileptic foam discharges. Brain biopsy, which is rarely done, reserved for unclear cases or suspected unusual pathogens. Now, the management. So first is hospitalization. Admit all the suspected cause to monitor neurological function and manage of the complications. Second is supportive care, in which the intravenous fluid are given, oxygen therapy, antipyretics, and anticonvulsant if the seizures occur. ICU care if there's respiratory failure or coma. Now, specific treatment for the different kind of encephalitis. First is viral, which is the most common, in which acyclovir or IV is given. Now, second is autoimmune encephalitis, in which corticosteroids are given. IV immunoglobulin is given. Plasma pheresis, suppressants which are cyclophosphamide also can be given. Now, bacterial encephalitis, which is rare but very serious. Appropriate IV antibiotics are given based on the culture. Now, tubercle or fungal encephalitis, in which antitubercle therapy or antifungal depending on the etiology. Now, complications. The complications are seizures, cognitive or behavior defects, motor diffusion, coma, or death. Now, rehabilitation. For rehabilitation, first is physiotherapy for the motor deficits. Second is occupational therapy for daily living skills. Speech therapy if the communication or swallowing is affected. Now, neuro psychological support like cognitive and emotion rehabilitation. Thank you.